I'm Matt Rutler. I'm the COCA president, and we welcome all of you, not just Region 3 folks, but I did see Region 4, 6, and 7 as well on this call. And that is really the idea behind having various times for these town halls so that whatever time worked best for you all, you had an opportunity to be able to jump on. So thank you all so much for joining us today. I mentioned about uh, the mute button. It's really just for background noise and to eliminate that. But there'll be plenty of opportunities for everyone to share and to speak, so don't worry about that. There'll definitely be time. Again, if you are on the call using a computer or tablet, there is the chat function on the right. If you could just sign in with your name and the camp that you represent, that would be fantastic. Our wonderful Jennifer is going to be monitoring the chat area. So if you have a question that's come up and you feel you can't get it out there on voice, you can also type it in the chat and we'll make sure that your question gets addressed. Just as a heads up, everything that we cover today, we are actually recording the town hall, and we are very fortunate. Ryan from Happiness is Camping is actually joining all of us, all of our town hall meetings, and is taking copious amounts of notes. So in addition to the slideshow, you will also get copies of all of our notes, the pre-survey, and after the town hall, we ask that everyone please fill out the post-survey. There's a link at the end of the presentation as well as on our COCA website. It's very easy to do. It shouldn't take more than 5 minutes, but it's a great opportunity for us to gather more information of what you learned from this town hall and what information is still needed out there, and also where we can go with the town halls later as far as information dissemination. We're hoping that this will be the first of many town halls, but obviously this one is very important due to the issues that we're facing with this virus. If you are going to ask a question or share something that your camp is doing in terms of any of the items that we have, if you could just please just let us know your name and what camp you're from. This way, as we take notes, we can attach those name and camp to the items that you spoke about. This way, in case we need follow up or would like to follow up, we know who really to follow up with. So Don is in control of our slideshow, which is fun. This is why he's muted, in case anyone's wondering. But Don, if you could go to the next slide, we're going to jump right in. And the items on this slide, just so folks have a heads up, this is actually items, these are items that camps have approached Don, myself, Jennifer, other board members, of things that they're actually already facing. And because of the impact of this virus on their camps. So these are some of the items that we'll be addressing today, as well as anything obviously that you all contribute and want to talk about. Our town hall in the next slide, was sent out to folks, the original folks who received the invitation. So what is our town hall? We do have an agenda. It's a base agenda, but it's a fluid agenda. It's where you all take us, and the conversation that is had. So it's the information that you need, the information you provide one another. That's where we're kind of going with all of this. So it's all about your input and all about your camp and concerns. What it's not, I can tell you, it's not a scientific study of the virus. We know the impact the virus has physically. We really now are concentrating on what the impact the virus has on our camps. It's not going to be a lecture. Hopefully this is as much as I'm going to talk, other than to introduce each slide and topic. It's really up to you all to contribute and to ask the questions and say the things that you need to say. So if you are on the call just to be silent, that's okay. I know a lot of folks, including myself, are still taking lots of notes. But if you have a question or a concern, not just of me or Don or Jennifer, but any of the folks that are on this call, that's the idea. We want you all to ask each other questions, follow-up questions, and anything like that. All right. So to jump right in, we're going to actually cover the topic of camp scheduling and operations. So before each topic, you're going to see two charts. What this is the direct results. It's this little snippet of the survey that went out to the member camps prior to these town halls. So we'll give you two graphs. So if you take a look at the pie chart, this is what the current state and local restrictions have that are affecting our camp operations. And the other chart, the bar graph, is actually about canceled event plans. So if you notice, the blue is canceled events in April, the yellow in May, and the blue in June. So these are just a piece of the items that are from the survey. Once again, we will make sure that you get copies of all of this. You will receive copies of the pre-survey, the notes from our town halls, and the post-survey results as well. So looking at that now, let's kind of talk about, and it's up to you all how you go about it, but let's take a look at, have you had to reschedule or cancel any of your camps, whether you're already talking about your summer camp or if you have other camps, types of programming, whether it be a sibling weekend or a parents or a family camp, and what are some of those criterias and things that you looked at to guide your decision making? And then if you are rescheduling, what type of things are you looking at? Or if you have to relocate, maybe your facility that you rent is not going to be open. Are you going to relocate your camp to another facility? So we want to kind of just touch about that for a few minutes. So if there's anybody who has anything they'd like to discuss about that topic, that'd be great.
My name is Kara. I'm with Camp Little Red Door in Indiana. We had a family camp weekend scheduled for the weekend of March 13th. And so where we do our camp is actually a part of Indiana University. And because IU had canceled all of their classes and everything, we had to cancel our family camp as well. We're not rescheduling it because we do a fall family camp as well. So I reached out personally to our families to let them know about fall family camp and to let them know that they can register for that. One of our families was on the brink of already canceling themselves just because of their kiddo and to keep the family safe. And the other family we had was super bummed about it, but understood and did go ahead and reschedule for the fall.
Thank you.
This is Becky Spencer from Camp Catcher Rainbow, YMCA Store Camp. And our camp is not until August. So we're just going on an order by order decision making from our government entities, and been in touch with some of our medical volunteers, and we know it will be different this year, but we're hoping to be able to run camp, but we'll see, right? And right now we've been sending out messages to our medical volunteers for their health and strength during this time, and also for our kids' health.
This is Bruce Hooper with Smile a Mile in Alabama. Pardon us crashing your region, but we're right next door to you. So we are a year-round program. So this has impacted us in several different ways. From a camp standpoint, we have 7 camp sessions in the summer. We've had to cancel the first of those, which is On Therapy Family Camp, which was set for late April. And that was at the guidance of Children's of Alabama. which is the children's hospital in the state of Alabama, and they also provide our medical director and advisory board. One of the oncology docs sits on our board. We're now looking at our next camps to be late May for sibling, a 4-day weekend in late May, which would be immediately followed by our youth week for 6 to 12-year-olds. And I would say that those at this point are in significant jeopardy. If I had to bet, I'd probably say with 90% to 95% assurance that that those will be canceled as well. So what we're kind of doing now is looking at whether, we can perhaps double team if we have those 4 additional sessions later in the summer, if we can kind of, perhaps where we've had a separate on therapy and off therapy, whether we could combine on and off therapy families. We may wind up combining the youth and teen groups just to make sure that everyone gets that experience, depending on what the rest of the summer looks like. And then as far as in-hospital programming, we have been out of the hospital for, I guess, almost 2 weeks now as a volunteer program and non-essential folks. So looking at ways, now to serve them virtually and from a distance. So trying to do whatever we can to help not only the kids and their families, but we really think it's important right now to assist the frontline healthcare professionals in any way that we can.
This is Daryl from Camp One Step. I'm curious. I was looking at one of the survey results, and it showed that some programs have canceled in June. I don't know if any of the camps on the call have canceled things in June, but what I'm curious is, how far into June were there programs? Meaning, were they canceling programs you're looking at June 1st, June 2nd, so on and so forth, or are we talking the end of June, almost July? I don't know if any camps on here have programs in June that they've canceled already, but we're looking at, we have programs in June, so we've canceled everything up and through May, but we're starting to look at June with a question mark. So I don't know. I'm just curious if anybody's canceled anything in June, and how far into June was their program scheduled?
Hi, Daryl. This is Kara with Little Red Door again. Our camp we have a June camp that is overnight, and it is June 12th through the 19th. And the place where we do our camp, we're waiting until like mid-April to have that conversation. Our organization also provides services to adults that are at any stage of their cancer treatment. We've canceled all of our adult programming and done some like Facebook Live stuff, but everything is canceled through the end of May at this point. And we're kind of holding off, waiting to see for June, and still really hopeful that our day camp in July doesn't get that question mark. But that's where we are with that.
That sounds like the same thing, because our sibling camp is June 13th to the 19th, and that's what so you guys are right in the same situation. So that's good to know that if you guys are looking at mid-April, that's helpful.
Yeah, I don't think I actually just talked to our CEO today, and we don't want to make any cancellations too early. I mean, we still have kids that are registering pretty consistently. Our families are still really excited, so I think that's really I have a lot of hope from that. Just the fact that our families are still registering at this time. But yeah, we're looking at middle to end of April before we make a decision.
So thinking about that as well, we hear about the folks that are waiting or who have canceled certain programs. For those who are in either situation, have you all contacted or assess the availability of your families? Has any of the families reached out to you with concerns, reluctancy, or how about, your volunteer staff? Any issues with their availability? Paid staff, since some camps do have staff that are paid, not just full time, but also the week of their program, and also the availability of your medical staff. Any folks having any issues or have been in contact with those folks?
This is Jamie
This is
Seal with
Bruce.
Camp Hobie.
Okay.
Sorry. And we
Go
have
ahead,
had
Jamie.
both volunteers and camper families reaching out at this point. Our programs, our main camp programs begin June 2nd, and then each week for the month of June, we have different programs running through. And we've had kind of a mixed review from families and volunteers right now about how they're feeling. So we're trying to assess kind of what our worries are about going into that. And one of the biggest worries we have right now is that for most of our healthcare facilities around here, if staff are exposed or come positive with COVID, they have to take 14 days off. And so we've already had some of our medical staff affected by that. And we're worried that going right from kind of the peak of this event into June, trying to have medical staff be able to have even the time to be able to come is one of our big worries.
This is Bruce. I can echo that. I think, well, first of all, our families have been incredibly supportive. They are all expressing disappointment about on therapy camp at this point, but completely understand the decision. And we'll go from there into late May and early June. Our volunteer staff, we feel pretty good about that group. Obviously, some of them are going to be impacted, through being laid off, losing a job. So that dynamic could change as far as their availability. But I would also echo that I think the medical staff is where we're going to have the most significant problem. I don't know if others are seeing this. I was talking to Sally Hale with Camp Sunshine in Georgia yesterday, and they're seeing the same thing in Georgia that we're seeing in Alabama, and that is that in children's hospitals, the census is way down. Obviously, elective surgeries and other things aren't being done, so we're seeing a lot of the nursing staff and others who are actually being sent home because the census is so low. And in the case of Children's of Alabama, they're giving them like an 80-hour COVID-19 bank, which is basically free hours for them to burn while they're off. But once they get past that 80, then they have to start using their own PTO. So just to echo the previous comment, I can see that presenting a problem in June, July, August, if those healthcare professionals don't have paid time off to use or have significantly depleted it.
Other thoughts or questions of one another regarding scheduling operations as far as staffing is concerned, as far as facilities are concerned?
This is Patty from Camp Quality.
Okay.
And we have a plan in place, and I would anticipate we're going to start canceling June. We canceled everything through May, and I would anticipate we'll start canceling June here in the next week or so. Our concerns are certainly medical staff. In many of our states, leaves have been canceled, et cetera. So we have some concerns with medical staff. We have concerns with volunteer staff. A lot of people are out of work, and their ability to give a week might be compromised. Also, there's a lot of uncertainty about what individual states are going to do with their schools and whether some of our teaching staff might have to, go back to work at some point in the summer when they weren't expecting to. So that is a concern. One suggestion I would just have for people, if you haven't already, is to talk to your insurance company, because there's a real question as to whether your general liability insurance will cover coronavirus claims. So we have concerns about how will we ascertain whether someone coming to camp, either a kid or an adult volunteer or staff member, would have the virus. Testing kits aren't widely available in many places. And if someone would, catch it on our facilities, we would be very challenged liability-wise to respond to that. So those are the things that we've been looking at in terms of just, and then as well, because we rent and we do a lot of hiring, bringing on things, what kind of financial commitments we want to make, given where in our various states they're suggesting this thing's going to peak. So those are some of our thoughts.
And just to build upon what Patty had just mentioned, in our previous town hall, one of our executive directors from Region 1 brought up the fact, and I want to put it out there for everyone to think about if you haven't already, the fact of if you have already been planning aspects of your camp, whether it be summer or, June, May, June, the fact of if you're signing contracts with vendors or other folks that come into your campsite, having a COVID-19 no harm clause in your contracts, as far as, if you are forced to cancel your camp, it's obviously not the fault of your camp. It's not the fault of the folks that are coming in to provide services, whatever it may be. But having that clause in there, has anybody already done that or in the process of or thinking about it? So having some type of clause in your contracts.
This is Daryl from Camp One Step. With some of the programs that and off-campus activities that our summer camp teams are looking at, they've begun to ask the question. They've not written anything in the contract, but they've asked, what if? What if we have to cancel this, and what's kind of your policy? And some of the feedback we've gotten so far is if we have to cancel because our organization cancels the program, then we are still liable for a portion of that. But if it's a mandated organization, if it's a mandated governmental shutdown or that kind of thing, then we're not liable. But some of these arrangements were put in place before this really hit the fan. So we're educating them to try and ask that question now.
Correct. Any other comments or questions regarding any of the items we were just touching upon? I'm going to say this, and I'm going to say this more than once throughout the town hall. The conversation, just because we switch gears and we start to move on to volunteering and staff recruitment, the conversation doesn't have to end here. I encourage you to continue to put your questions down in the chat room. We'll get to that. There are also going to be opportunities at the end of the town hall where we'll connect you all with our Instagram and our Facebooks and our listservs, as well as our post survey that you can obviously get into a little bit more depth and ask more questions in case we didn't get to it right here. Okay, so we're going to switch gears just a little bit, and we touched a little bit about our volunteer staff and our paid staff. But on our next slide, we're going to talk about volunteering and staff recruitment, because that seems to be an issue across the board as well. Here's two survey questions that went out prior to our town hall in regards to, are you confident you'll be able to recruit sufficient volunteers to run camp at last year's levels? In the blue, in the first one, is a yes at 52 or 57%. Can't see, it's small. And then the other, are you confident you'll be able to recruit enough medical staff based on last year? And the blue obviously is the yes as well. So interesting enough, the camps that have provided that feedback on the survey this is what they're saying. So again, we'll send those results out to everybody afterwards. So talking about staffing, I want to open up for a few minutes to just talk about, how are we recruiting in times like this? How are we switching gears with interviews? Obviously, nationwide and Canada, continent-wide, we'll say, we're not really being able to do face-to-face interviews. So how are we doing our interviews, and what are we doing as far as training is concerned? So I'll open that up for discussion as well.
Maddie from Camp Sparkle here. We're in the Seattle area. I'm continuing to recruit volunteers. We have a smaller camp staff probably than most people, but we have a lot of teen volunteers. So actually the teens are signing up like crazy because they have nothing to do right now and they don't have school. But I'm just being really transparent that there are things up in the air and day-to-day decisions are being made. And so I'm trying to give them realistic timelines on when, and be as transparent as possible about our decision making.
Great.
This is Bruce. We did complete our interviews, which typically are done in a group setting. We managed to get one of those group meetings in before things changed. So the rest of our new volunteer candidates, we wound up doing one-on-one interviews with, which we've done some of that in the past. So that worked out fine. We were scheduled originally to have our volunteer training on the first Saturday in April. So obviously that has been canceled. That is typically a day that we set aside when we insist that all of our volunteers, both new and returning, have to spend about half day or a little more with us in Birmingham. We'll be now doing what we can of that content through video and on a virtual basis. Not on that Saturday, but we'll get everything in place where our volunteers can kind of do that at their own pace with a deadline for it to be completed. And it'll be condensed probably into no more than 2 hours, which will then make the on-site training preceding each camp session very, very important for us. And obviously we'll probably ask those volunteers to come in and, probably spend an additional full day more than they would with us before camp kicks off.
Jamie again. We actually were able to do 90% of our interviews with all of our volunteers. They're completed at this point with Google Hangouts. So we would gather as a group, everybody introduce each other, kind of do some of our group work together, and then break off and do all so you could still see face to face. They could see who they were talking to. It was great. And it worked out really well.
This is Kara with Little Red Door. So we have most of our medical staff were luckier and they're all returning. But my concern is with in Marion County, we've had, as of like this morning, 161 cases of COVID. So my concern is do I start preparing for a backup just in case? And if so, right now, recruitment on that, we're not getting a lot of response from medical staff because they are busy. As far as our volunteers and things like that, we're not lacking there. We are moving everything to online training. Again, we are a smaller camp and we do 1 week over the summer overnight and 1 week as a day camp. And so most of our staff is returning. So I think that's our benefit there. But right now my concern is just that like having a backup if needed, if we do move forward with camp in June.
Hi, this is Ashley with Arizona Camp Sunrise and Sidekicks. Just to follow up with like Jamie and Kara, I'm kind of in a different boat where I'm actually the only paid employee. So everyone, including my camp director and everyone, is all volunteer based. So in those aspects, I have people that are set and good to go there. But as far as trying to find the medical volunteers, I'm kind of in the same boat. We had a spring retreat that was scheduled for the weekend of April 17th that we canceled just simply because our medical staff was unable to, get that time off to come provide care for us. And we were also able to do it before our 30-day mark with our contract, so we were reimbursed for the funding for the camp location. But yeah, same thing, kind of concerned about how we can get backup volunteer medical staff and what that'll kind of look like for us moving forward, especially with their increased exposure and what's happening in Maricopa County. So I feel your pain and any recommendations on how to best kind of get more people involved and maybe lined up and ready to go would be great.
Well, and another thing I know on the email, it mentioned like having staff tested. So in Indianapolis, Eli Lilly is doing testing for medical professionals. So I don't know how long that's going to continue. So, I think if we continue to have camp in June, we would want our staff to be tested. But then the concern is like, will we have tests? How quick can we get them back? How soon do we have that? And then again, when we get the results, how are we going to find additional medical staff, follow through with that, make sure that they aren't testing positive, and get everything that we need to within that time frame. So it seems like our time frames are so unknown that there's just a lot of uncertainty with medical staff, which is absolutely a necessity for camp. So another added barrier for us, I think.
Mhm. Any other thoughts regarding staffing? I know that it seems to be an ongoing issue. We heard it as well on the first town hall this morning. Um, some camps obviously have an easier time than others, but medical staff, yes, seems to still be the ongoing issue.
Yeah, this is Bruce, and I mean, that's going to be the thing that's kind of outside of all of our control, which is so difficult to wrap our heads around. That I mean, we are going to be at the mercy of what the situation is for these healthcare professionals, and right now, you just don't have a crystal ball to know how that's going to play out. So that really is problematic.
Hey, Matt, one question we have is what is the minimum number of nurses camps typically have? If you have approximately 100 campers for an overnight camp, this camp typically has 5 to 7. What would be a minimum?
Okay, we have some folks who are answering on the side as well, which is great. Kara said that they have between 80 and 100 campers with 1 medical director and 4 to 6 nurses. I can speak as far as my camp is concerned, Camp Happy Times. We typically have 1 oncology doctor, and then for our week, we have approximately 150 campers, and we have, I would say, 10 nursing staff, whether they are nurse practitioners, RNs, or that would also include our residents as well. So again, if folks know those answers or have something, if you can just put into the chat box or let us know. You can also, feel free to email us answers to questions that come up if you don't have the opportunity to write it down. But that is honestly a great question, is, your minimum number of medical staff per camper. That's a great question. Great. So keep those coming. So I do want to move on real quick to talk a bit about fundraising, because I know that is definitely a hot topic that has come up in the last week or so. So again, here are two pie charts regarding from our survey. The first being, has your fundraising been affected by the current restrictions? And the blue represents yes, it has. But the other pie chart, which I found very interesting as well, is it likely that the lack of funds may prevent you from holding camp this year? The yellow color at 72% is no. But there is still a significant unsure, and definitely a portion of yes that is going to affect their camp. So what I really like to do is spend a few minutes talking about fundraising. And if you had to reschedule your fundraising events, replace or cancel, have you started any outside the box ways of fundraising? Have you thought about stewardship and reaching out to your donors, even if it's just to say hi and how are you doing, rather than asking them for money? Love to hear your ideas regarding this topic and how your camp is addressing it.
Yeah, this is Eddie Bobbitt from Camp Quality Kentuckiana, and one of our big fundraising campaigns that we do every year is our Making Camp Possible campaign. And with this campaign, it's really geared towards working with the local mom and pop places, your local mechanic, your local barber shop. And we typically will get anywhere from $500 to $2,000 donations from each of these little mom and pop places. Now, thankfully, we had a really good jump on the year, and we've got a good start to that campaign. But right now, with what has happened, don't really feel comfortable reaching out to some of these individuals from a fundraising standpoint. I've reached out to them all, just saying, hey, here for you if you need anything. But I'm anticipating our Making Camp Possible campaign this year to take a significant hit. In addition to that, some of the foundations that we usually get grants from, I've already heard from a couple that are suspending the grant application for this part of the year, for the spring, so that they can put that money towards the hospital that's nearby for equipment, and put that money towards the local businesses who are impacting right now. So, yeah.
This is Bruce. I agree with Eddie. We are very blessed in that our most significant fundraiser of the year was on February 22nd. So, I mean, it's probably one of the 3 largest galas in Birmingham. And, we set an all-time record with that. Three weeks later, the Heart Ball here in Birmingham was postponed because of COVID-19. They've moved it to May, which clearly now that's going to present a problem for them. So, and we're seeing a lot of small nonprofits who during this time have obviously tried to do virtual fundraising rather than in-person fundraising. This is the big question that's going to impact us all, because as Eddie said, I mean, dollars are being funneled now to COVID-19 opportunities, but we are in hospital programming. I think we will wind up actually getting some support through that we haven't had before because of the piece that we are focused on for healthcare professionals. So we've got an event. Our junior board has an event in late June, and I know Katie Langley, our special events director, is on this call too. And, that one's kind of on our radar now, looking very iffy, honestly, for late June, because, the last thing you want to do right now is to go out and ask our great friends, vendors, retailers, restaurants for anything. We've kind of turned that around because we know that, this too shall pass. So one of the things we've been doing on social media is to go out there and post and remind our followers of local restaurants here in Birmingham that support Smile a Mile and have supported us for years, and kind of turning that around and saying, hey, right now, remember they're open during doing curbside pickup. Please support them. And, we've seen a lot of heartfelt gratitude from these small folks who are just trying to do the best they can to stay in business. So I think it's kind of the time for us to think about, making sure that we thank them, and we know that'll pay dividends in the long haul.
I actually really like that idea. This is Kara from Little Red Door. We've not done that yet, but what we have done is our development team, in collaboration with myself and my boss, have started we're doing a lot of handwritten letters. So instead of emailing donors, we are very fortunate that our biggest fundraiser for camp occurs in August the year before. So last August was our fundraiser for this year's camp. But so we've done a lot of sending personal handwritten notes to our donors and our medical staff and supporters of camp to just let them know. We didn't want to be another email that they get in their inbox about what we're doing during this pandemic. And we've had a really positive response from that personal touch of sending out emails. Our development team is really doing a lot of great work on our behalf, so we're really grateful for them as well. But I think that personal touch, which is something different than we would normally do, and people think now, with the technology that we have, it makes it easier, but we're seeing a lot of well-received responses from the personalized handwritten notes or outreach.
Are there any camps present today that are working on fundraising? So maybe some outside the box ways of fundraising, whether it be through social media or other virtual opportunities, or maybe folks that have had a fundraising campaign that are just so happens to overlap with all of this.
Hi, this is Ashley with Arizona Camp Sunrise and Sidekicks again. So we actually got really lucky. Arizona Gives Day is on April 7th. They annually raise around $3 million for local nonprofits. So we do have that coming up for our online campaign. And then I also kind of got creative. We typically sell shirts when we go to tabling events. So I created a online campaign for our kids and families to get involved with designing a t-shirt that we can then later sell at some of our events, at camp, whatever, to raise some funds, and maybe even do an online campaign with that once our top 3 designs have been chosen.
It's also a nice way of keeping the campers and families still involved outside.
Absolutely. We figured, everyone's sitting at home right now twiddling their thumbs, so might as well get them involved and give them something to get creative with.
Great. Thank you. All right, so we again can come back to this. If somebody has a question or a comment, please feel free to use the chat or chime in. But the last part of our, or the main part of the last part of the rest of this town hall is really to talk about contingency plans and things that folks are already putting into place. Whether it's virtual camps or somehow bringing camps to the campers. So Don, if you could switch over to the next slide. So this is for those, we just want to play a quick short, and it's playing but we can't hear it. But that's okay. It gives me an opportunity to talk a little bit more. So for those who haven't seen this video yet, this is actually an a cappella choir. You can Google it after, or when we send you the link with the slides, you'll actually be able to see it. That was, they had a concert that they were performing, and it unfortunately got canceled due to the virus. But the amount of work that they put into it, there's a real strong correlation between camp. The amount of work that they put into it, the amount of time and effort and preparation into their show, they didn't want it to go to waste. So they took it upon themselves, the students, to create a Zoom concert where they then went live and put it out there for everyone to see. So they did continue their concert. It was just done in a very out of the box way of presenting. So that really kind of leads into the results from our survey, that if you cannot hold camp this summer, have you developed plans to bring kids to camp? In the first pie chart, and the blue section is a yes. There was a caveat with the no section, which leads to the other pie chart, which is, have you considered to make plans to provide virtual programs and services? And the green in this case is the yes. So we want to talk about in the last portion of our town hall is what have you all done, or what have you all thought about, whether it's Facebook pages, media posts, social media posts, video posts. We have some ideas that have been presented to us already. That's why we added these to our list. But what have you all been doing, or have any other ideas or suggestions that you could share with the group?
Matt, this is Patty with Camp Quality, and we have developed it's a combination of a virtual program as well as things that will be delivered to the campers that we plan to roll out to our staff on Tuesday. And our intention is to be able to, as we send notification, because we think we're going to, as I said, have a number of cancellations. So our goal is that as we send the notification to families about the cancellation and volunteers, that we include with that what we plan to do in its place, our alternative camp, hoping that will, temper some of the disappointment on the part of both our families and our volunteers.
Mm-hmm.
This is Maddie from Camp Sparkle again. I echo that. I've been working on an alternative plan for a week or so now, because I think it's really important that in our messaging, if we do end up canceling our camp, that we give parents and families and kids some really actionable steps of ways they can continue to stay engaged. So I've thought about show and tells and talent shows, a pen pals program, working with some of our partners to put our therapeutic activities like filmed and online on our YouTube channel, that sort of thing.
Hey, this is Rich from Camp Kids Against Chicago, jumping in on this. No contingency plans for camp just yet, but we have started today a sort of a way to reach out to our families and our staff to keep them engaged as we're all in lockdown. And we named it the hashtag COCA-I challenge, and it started off with a song challenge today. And one of our system directors tagged like 3 of us to go do a camp song and spread it out there to our families to see if they can all get engaged and kind of do campy stuff. I've been following a lot of stuff on a Facebook group as well as a Slack on COVID-19 and what camps are doing to keep their staff and campers engaged. And it seems to be a lot of that going on out there with virtual campfires and virtual programming. So if you haven't seen those yet, I think Tom Prater actually shared it with me. It's some very interesting resources out there and a way to kind of be creative during this time as our families are not supposed to be outside and or at least with other people, how to engage the camp family. We even talked about it last night with our leadership team, talked about the possibility of doing a Zoom by cabin game night, if you will. So maybe playing one virtual game with the oldest boys cabin one day and then the oldest girls cabin on another day with a moderator, sort of like what we're doing here, but just to keep our campers engaged. So nothing for the summer yet. We're keeping our fingers crossed, but for now, as our families are isolated, if you will, we're sharing resources that we find online, resources that have been shared by our hospitals, and just trying to keep everyone a little bit more sane and camp happy.
That's great.
Amen.
I mentioned this morning, but if anybody follow Kids Need More on Facebook, it's another one of our Region 1 camps. They've been doing fantastic Zoom sessions for the last 3 or 4 weeks. So they actually work with a nonprofit that provides basically Disney characters who they do Zoom meetings with their campers. So I think they had Elsa and they had other princesses doing it. They also do a lot of games on there. They did interactive yoga. So we've been using some of what they've been providing, and our kids have loved it. So they're definitely a good jumping point if you want to give them a look.
And I'll just take a second just to encourage everyone that if you are doing something that is out of the box or that is fantastic, we definitely would love to share in your successes. So please feel free, if you're doing it social media wise, just tag COCA. You can also email Dawn copies of things so it can be disseminated to the membership, because we really do want to share in your success and also steal from you without exaggeration there, because that's what we do. We share the best, we share the wealth. So definitely, if you are doing something wonderful, let us know. We'd love to be a part of it as best we can.
Sorry, Rich, one more time. I forgot to say that we were definitely going to try to throw this out there to the COCA community with the song swap challenge. So if you like it, if you want to join in, let me know, and I may just reach out and tag a few of you that were at the Region 3 COCA-Con anyhow, just for fun. You're next.
Rich, I also saw that virtual escape rooms are a big thing right now, Rich. So we're all expecting that from you.
That would be disappointing if he didn't.
You have a lot of time on your hands right now, Rich. All right. Are there any other questions or anything that we may not have covered, or any other ideas that anyone would like to share? Anything that we may have glanced over, but you have some more thoughts on? Definitely love to open this up for now to anyone who has any thoughts.
This is Patty again, Matt. I guess my question as I'm listening here, what is the set of circumstances under which, and maybe this is too much to answer right now, but maybe it's something COCA could look at. What is the set of circumstances under which a camp should be evaluating, whether or not to open camp? I mean, we're talking a lot about, waiting to see, I mean, I'm curious. I know we've developed our set of circumstances, but is there any plan to have, some guidance from COCA or from some type of medical resource to describe the set of circumstances? I mean, is it okay if somebody, if we're off the lockdown in June, is it okay for a camp to open up without any type of testing? Is it okay for a camp to open if the CDC recommends something different and their state isn't following CDC recommendations? I'm just curious as to the, I understand the reluctance to cancel and, kind of holding on for the right decision. I'm just wondering, is there any set of guidelines or direction or suggestion planned by COCA leadership to give camps some guidance as to the things they should be taking into consideration?
That's a phenomenal question, Patty, and it's actually an agenda item that we are adding to. For those who don't know, our COCA board is actually meeting next Wednesday via conference call. We don't meet in person. So that's actually an agenda item that we are adding to our board meeting call, Patty. So that's going to be a good discussion point for us to talk about. And one of the reasons why we did move, our board call was actually supposed to be last Wednesday. But because we were in preparation, Don, Jennifer, and myself really gung-ho to get these town halls off and running, that we postponed. The executive board decided to postpone the meeting to really gather a lot of feedback from the members, from the membership, and that's why we're hosting these 8 town halls, so that we can get as much information from you all as we can, so that we could come up with discussion points and things to look at in preparation for those decision making, those very, very difficult decision making. But thank you, Patty. That is definitely something that we are going to add to our agenda for next Wednesday.
Great to hear. Thanks, Matt.
Of course. And Patty, in case there was a question posed in the chat that asked if you'd be willing to share the criteria that you all at Camp Quality have created, have developed.
Yeah, I'll send that to Don.
That'd be perfect. Thank you all. We can definitely include that, everybody, in the notes that we send out.
Yep. Yeah.
I'd love to
see
see that.
Don, and then he can distribute it. Sure. Okay.
Perfect. Thank you for that. Don, if you could just go to the next slide real quick to wrap it up, because I want to take into account everybody's time and everything. On the next slide is just, for those who don't have it, these are email addresses for Jennifer, Don, and myself. If you have any questions, any concerns, anything that came up today that you'd like to be included in our notes out to the membership, please let us know. These are our other ways of getting in contact with us via Facebook, listserv, Instagram. And the last thing is, please take a few minutes. There's a link on the next slide, as well as on the COCA website, COCA-I.org, to fill out a survey. This survey is really important. This is our post-town hall survey. It's going to ask you questions about your takeaways from today, further questions that you may have, but also, in all honesty, these are our first town halls that COCA has ever had. So we really want feedback on the town hall itself and possible topics for the future. So if you would be so kind as to fill out that survey, that would be great. We would obviously be sharing those results with you as well. and I wanted to make sure everyone was clear that when we say we're sharing these results and the notes from the town hall, it's going to be notes from all the town halls, not just the one that you attended, because we want to make sure that everyone gets as much information as they can from across our continent, across our membership. So I just want to take a quick second just to thank everybody so much for spending this time with us and being on this call. It has been extremely informative. I took my own notes as well. And just please, everyone, be safe, be well, and take care of yourselves and your campers.